Modern Dental Assisting Chapter 1 Principles and Techniques of Instrument Processing and Sterilization. One of the most important responsibilities of the dental assistant is to process contaminated instruments for reuse. Instrument processing involves much more than sterilization. Sterilization is a process intended to kill all microorganisms and is the highest level of microbial destruction. There are 7 steps for instrument processing. These include transporting, cleaning, packaging, sterilization, storage, delivery, and then quality. The classification of instruments includes critical instruments. These are the items that are used to penetrate soft tissue or bone. These also have the greatest risk of transmitting infection and must be sterilized by heat. Next, we have semi-critical instruments. These instruments only touch mucous membranes or non-intact skin. They have a lower transmission risk and are sterilized by heat or can receive minimum high-level disinfection. And non-critical instruments. These contact only intact skin. They have a low risk of infection transmission and are cleaned and processed with EPA-registered intermediate or low-level disinfectant. Next, we'll talk about PPE, personal protective equipment. You must always wear PPE when processing instruments. This is going to include your utility gloves, your mask, eyewear, and protective clothing. Transporting and processing contaminated patient care items. The dental assistant may be exposed to microorganisms through contact with contaminated instruments or other patient care items. Exposure can occur through percutaneous injury, including needle sticks or cuts, or contact with mucous membranes of the eyes, nose, or mouth. The instrument processing area itself should be centrally located in the office and allow easy access from all patient care areas. This is going to be dedicated to only instrument processing, should be separated from operatories and the laboratory, and should not be part of a common walkway. In the processing area, we should have windows and doors, air circulation, enough space to accommodate all equipment and supplies. We should see deep sinks and seamless hard surface flooring. Workflow pattern includes 4 basic areas: the receiving and sorting, the preparation and packaging, the sterilization itself, and then storage. If the instrument process area is small, you can use signs that read contaminated only, pre-cleaning, clean items only, and sterile items only. The contaminated area is the initial receiving area. These are where our soiled instruments are sorted and pre-cleaned. We would any disposable items are going to be discarded in this area. This is going to contain clean protective eyewear and utility gloves, some counter space, a sink, waste disposal container, your holding solution, ultrasonic cleaner, eye wash station, and then supplies for wrapping the instruments. Preparation and packaging area is where our clean instruments and other dental supplies should be inspected, assembled into trays or sets, and then wrapped in or placed in packages for sterilization. This area will include counters, storage, fresh disposable supplies, and prepared trays. Clean instruments are not sterile and could harbor pathogens. Pre-cleaning and packaging instruments. Instruments may be pre-cleaned in one of 3 ways. We have our holding solution, our ultrasonic cleaning, and then our instrument washing machine. Holding solution is a solution to prevent drying of blood or debris. Any non-corrosive liquid. We're not going to use a disinfectant as holding solution. This is only necessary if instruments cannot be processed immediately. We're going to change the solution twice a day at minimum. And there should be a lid that is labeled biohazard. Our ultrasonic cleaner is used to loosen and remove debris from instruments. When using, we're going to wear puncture-resistant utility gloves, a mask, eyewear, and a gown, and we'll process our instruments until they're visibly clean. Ultrasonic cleaning solutions come in a variety of sizes and types. We have packets, tablets, concentrate solutions, and then also ready mixed gallon. If we notice that our ultrasonic cleaner isn't, um, if you notice that the instruments are not being cleaned completely with processing in the ultrasonic cleaner, the unit might not be functioning properly. To test, we would hold some foil 5x5, submerge halfway into fresh, unused solution. We would run for 20 seconds and then hold the foil up to the light. If it's running correctly, we should see dimples in the foil. Automated washer and disinfector. These look and work similar to a household dishwasher and must be approved by the U.S. Food and Drug Administration. They use a combination of very hot recirculating water and detergents to remove organic material. Instruments and burrs made of carbon steel will rust during steam sterilization. Rust inhibitors such as sodium nitrate and commercial products can be used to help reduce rust and corrosion. An alternative to a rust inhibitor is the dry instrument thoroughly with the use of dry heat or unsaturated chemical vapor sterilization. Before sterilization, the instrument should be wrapper packaged to protect them from becoming contaminated after sterilization. We can also group into special setups such as crown bridge, amalgam, prophylactic, or composite. Sterilization packing materials and cassettes are medical devices and therefore must be FDA approved. We're only going to use products and materials that are labeled as sterilization packaging. Specific types of packaging material are available for each method of sterilization. All unwrapped An unwrapped cycle, sometimes called a flash sterilization, is a method for sterilizing unwrapped patient care items for immediate use. Unwrapped sterilization should only be used under certain conditions.